Hey everyone, a common question I get is what happens on the first day? So on this episode here, we're going to explain what it is we do in detail on the first new patient visit. So this is the room that we generally go in. It's our x-ray suite. As you can see, we have the x-ray equipment behind us, also an examination table as well. The first step in the process is ultimately making sure we find a time that works best within your schedule to get you in here, because a new patient exam takes 30 minutes. Within that 30 minutes, we do a lot of things, but ultimately I keep it simple in that I want to find out why are you experiencing this discomfort, or what are some ways that you believe I can serve you. You don't have to come in with symptoms. You can be an individual who's just looking to build a wellness lifestyle. So it's just, hey, I just want to know, what's my spine's health status at. But for individuals who are coming in with symptoms, it's, hey, I want to answer, why are you in this pain or discomfort? Why are you having these symptoms? Where is it exactly? Symptoms can fluctuate. They can be different day to day, can be different in the morning, different at night, 1 week different than the other week. So that's why I ultimately want to find out, where is the source coming from? And the last thing I want to answer is, can I help you? That's the biggest thing, because ultimately, if an individual does want to seek out care here, I have to figure out whether or not I'm the right practitioner for you. So through that process of 30 minutes as a new patient visit, we go through health history, we go through a consultation of just, hey, where's your pain located? What are some things right now that are difficult to do? Any past history of an auto accident, a slip and fall, any broken bones or surgery? Because we noted that an impact injury that was left untreated, maybe it was a year ago, several years ago, they actually can change and manipulate and remold the spine and actually accelerate the degeneration process. So it's definitely we need to know if there's any past history of injury to this area before we even move forward. And then from there, it's, all right, let's get started. We first start off with a posture exam. So posture is pretty much the window of which your body moves through. So it's standing upright, it's noting, are your shoulders sloping? Is your head rotated? Is there tilting? When I see that, it lets me know, absolutely, there's some discomfort going on maybe behind that left shoulder, and your posture is showing it. So why are muscles holding you in this position? With individuals who are coming with a low back complaint, and maybe we are thinking that there is some type of disc degeneration, disc bulge, or herniation, I see it in their posture that they can't keep their shoulders over top of their hips. So they're leaning away from the area that's affected, and it's observable in their posture. Same thing, it's, why are you in that position? You must be avoiding something going on here. There has to be something that's getting in the way or that's causing you pain or discomfort just by having a good, normal, or ideal posture. Posture is absolutely important. That's why it's the first thing we do, because ultimately it's when you move, when you walk, when you sit up, sit down, how your body, your posture is changing is how your body is having to force itself to move through. And that's where we get that wear and tear. And that's when things get worse over time. We want to make sure that we identify areas where there's concerns, and we start the process and continue the examination from there. Want to check range of motion. Stiffness isn't normal. Discomfort isn't normal. You should be able to have the capacity to move. And that's why we want to focus on movement as we progress through care. We always want to make sure, as I mentioned, are you at the right place? So we do a neurological exam. We'll check reflexes, we check muscle strength. Because is your pain actually coming from something source located or near the spine? Or is there something going on with the brain or the spinal cord itself? I have to differentiate the two. Because some conditions I cannot treat, you need to go somewhere else and refer you to the right professional to help you out with that. Other conditions, it's absolutely, we've ruled this out. Your brain, your spinal cord, we're not having any issues or neurological issues, we can, progress through treatment. But ultimately, it's making sure that we look and identify through a chiropractic exam, where are there levels of rotations of bone that are out of alignment? Where's the inflammation at? Where are the weak muscles? So when a joint doesn't move, so on the spine here, if a joint is locked or fixated in one spot and it doesn't move, it starts to change the posture of your spine. Now your brain is trying to send a signal through these nerves, but with this rotation and change, it's actually changing the way that that brain is able to send its signal through that nerve. That means that the muscles aren't receiving the right signal, so they start to weaken. Your posture continues to change. Maybe it's a little bit harder to pick up the laundry basket or put on, your pair of socks or boots or shoes, or maybe there's something going on with your upper body that it's just a little bit more difficult to reach overhead. Maybe it's a little more difficult to reach out in front. Maybe sitting and being able to concentrate on work, whether it be school or whether it's actually work, maybe that concentration, you're starting to get these shoulder pains. You're rubbing your shoulders. You're trying to figure out what it is that's going on. Change in alignment to the bone changes the way that the brain is actually able to send that signal to the muscle, which changes posture, which weakens the connective tissue, which then ultimately starts to affect this disc and it starts to dehydrate or degenerate. And that's what we don't want to get to that point. So my advice is this: if an individual, if we see a lot of stuff and there's these patterns, these changes, I need to figure out, is the bone healthy? Is the disc healthy? What is the status of your spine's health? So that's why we're always in the x-ray room, or we try to be in the x-ray room, because we'll take some images if we need to, because we want to assess, are the discs healthy? Remember, they're there to protect the bone above from the bone below, and they're there as the shock absorber for your spine. But with that too, we want to make sure the bone, the building block of your spine that's there to protect your brain and spinal cord, we want to make sure that your bone is healthy too. The most difficult conversation I have to have is when an individual is coming in with immense pain and it's something that hey, there's so much degeneration here that these bones are actually moving around into different positions that it isn't normal, that we could try treatment, but ultimately, if we do, you may still have some residual issues. It's being open and honest about what the expectations of care are. But as always, as I mentioned when I first started this episode, why are you in pain or discomfort? Where is it exactly, and can I help? So we do all that within 30 minutes. Then we have a follow-up second day appointment, and that's where I provide my report of findings. Because again, I ultimately want to make sure that I am the right practitioner for you. Every individual who has gone through care, we've been going through that process, and every individual who is committed to their care has seen some awesome results. And that's what we ultimately want to bring. We want to bring the enjoyment of life back to you, but it's a process and a lot of the action happens on your end. So if you're interested in a consultation, please give my office a call at 763-432-3932. We look forward to your phone call and we're happy to serve you.